because closing this clinic is going to leave a lot of people who are most vulnerable, the mental health community, out here in the streets where a lot of crime and violence is arising, especially noting that the summer is on the way. One of the things we wanted to do was have a presence out here to say that the people out here are not giving up.
Occupation is not leaving. Why is it that we can elect a president from this ward, from this Illinois State Senate district, but we can't keep our clinics open? Is that right?
No!
Is that right?
No!
We have people and children that are being treated at some of these clinics because the parents are in jeopardy. Those children's lives are changed and made safer. When we've gone to the clergy, they turn their backs on us most of the time. Father Flager is more interested in walking children to school. When we went to him, the mental health movement, and we told him that walking kids to school is not the issue. The issue is keeping those children that feel like shooting and killing, keeping them safe and getting them mental health treatment.
That's right.
His position was, well, that's not on my list.
Without this $3 million that you can raise to increase health care, you're going to have a higher increase in incarceration. You're going to have emergency visits in the hospital rooms. These policemen, law enforcement is going to be more intervention. We need mental health services.
We need some support. And when they closed this clinic down over here, we had a lot of support over there. We had mental health doctors, we had therapists, we had so many people that's gonna help us and everything. But by they taking this here out of the neighborhood and the people that's over there got problems and everything, it's gonna create more problems.
He's closing these mental health clinics and it's gonna have a major impact in our community. I can guarantee you that it will be a surge in the number of people with mental illnesses that are arrested. So the new mental health clinic will become 26 in California.
This is a question about why, when the city of Chicago has $20 million left over in surplus from snow removal, when the city of Chicago has $65 million left over from G8, when the city of Chicago could raise taxes on a few of the wealthiest by starting a yacht tax, as was proposed by Alderman Cochran, why we cannot find $3.3 million to keep these clinics open for one whole year, and why we cannot find the $6 million that would keep them open and better and improved for the services that we need in our communities. This is a question not about the city of Chicago being broke. This is a question about who the city of Chicago thinks is valuable.
When the projects went and they got demolished, the gang structure left. They took away the leaders. They used that money to go up to the top to redevelop the city and property, but they did not redevelop the children. We need these services to help the kids. That's why we need them for the future. Their parents need these services to raise the kids.
We should not be out here begging for the healthcare clinics to be open for mental health, particularly at a time in this nation where people are in a really bad way.
I have received life-saving treatment at our Chicago public mental health centers. Yesterday, we experienced what Ram has in store for us. Instead, bless you. He wants us to go from the clinics to the jails, and that's exactly what he did. We saw a fast-forward version of that yesterday, and the tragedy is the police are not prepared to take care of the mentally ill. We need our clinics. We do not need to be handcuffed and put into jails in conditions that intensify conditions like anxiety, psychosis, and the other things that we have to deal with.
Now, we will not sit silently.
I'm only going to speak for a moment, but I thought it was important to speak up for some people who couldn't be here tonight. This past year, I lost a friend. He suffered from severe depression, and he ultimately took his own life. Medication and proper counseling could have saved him. He was one of the most talented and generous and good-hearted people I've known. He should be there for our fellow human beings. That's what we should be about as a city, as a people. We need to help each other, and we need to fight for that principle. We need to stand for that. Because if we don't stand now, they're going to take all of that away from us. We're going to be run on corporate principles. We're going to be run for money and not for the people. We are the people. If we take back our power, if we demand change, we can have it.
Yes, we can.
And we don't have to lose people like my friend. We don't have to lose them. The need for care is increasing, not decreasing, and yet we are pushing out people that are already getting care. There is no excuse for that. It is unforgivable, and it has to be corrected. It can still be made right. We have to do that.
But they have no complaint, they have no victim, they have no witness. We have permission to be here from the owners. Obviously they're confused about what they're trying to do. But they had told us we have to leave, we're not going to leave.